The following program presents principles designed to promote good health and is not intended to take the place of personalized professional care. The opinions and ideas expressed are those of the speaker. Viewers are encouraged to draw their own conclusions about the information presented.
Hello and welcome to Health for a Lifetime. I'm Don McIntosh, your host, and today we're joined with Dr. Kevin Bryant from Wichita, Kansas. Welcome, Dr. Bryant.
Hello.
What kind of medicine do you practice there in Wichita?
I'm in family practice, but primarily in the area of geriatrics and long-term care medicine.
So when you say geriatrics, what age group would that be?
Most people think of that in the over 65 retirement age population.
Which is an increasing population in America, isn't it?
Absolutely.
Today we're going to talk about a subject that many people in that age category, but others, family members deal with, and that's nursing homes, and more specifically, choosing a nursing home. And I think that's probably a very important topic for the time in which we live.
Yeah, studies show that in America, 43% of Americans at some point in their lifetime will spend some time in a nursing home. So it is an important topic, and for children of aging parents or sometimes spouses, this may be one of the most important decisions that they need to make in their lifetime.
Probably a lot of anxiety, too, that goes with that decision, both for the people that are considering it and those that are maybe going to be in that home. Is that the only choice they have? Is the nursing home the only choice they have?
Well, our first illustration talks about some of the other options, and obviously a home setting is going to be your best environment because it provides that familiar setting and surroundings, people that the person has known for a long time. And if they have some memory impairment, these become very important to helping them remain calm. But it does frequently require 24-hour-a-day coverage and care. And so that's why at times it becomes almost impossible for families to care for their aging loved ones at home. There are some ways that they can try and supplement that 24-hour coverage by adult daycare centers, where if they're working, they can take their family member to an adult daycare center. And sometimes respite times, these are where they can take the aging parent to, for instance, a nursing home for maybe a week if they're wanting to go on a vacation or something like that. Gives them a break so that they can recoup their energies.
These sound like excellent ideas. I don't know if everybody would know about those ideas, but let's say someone there is saying, hey, I'm watching this program and I know that we have to face some of these decisions. Who really should they be talking with? Who should they go to and counsel with concerning finding the right type of situation, right time at a nursing home?
Well, as a Christian physician, I believe we have a source of knowledge that we can tap into. And our next illustration gives us a verse from Psalms 32:8, where God promises that He will instruct us and teach us the way we should go, guide you with my eye. And I think this goes even to the point of being able to guide us to just the right nursing home environment for that parent or spouse. And I believe God's interested even in those choices.
Claiming that promise. Have you had people that have claimed that promise or have really done that just come and feel driven to talk to you?
I can't remember any exact instances, but I know of the parents that the families that I work with, many of them Christian, are deep in prayer about this issue.
Mm-hmm. What kind of, someone's just starting out, maybe they really have been in prayer about this, maybe they have counseled with people professionally, maybe they're not really doing some of those things, but what initial advice would you give anyone looking for a nursing home?
Well, first of all, one trap that I see, and this next illustration talks about it, is that frequently people fall into a trap of thinking, I need to find the closest long-term care facility to my home so that I can be quickly there if needed. And actually, being able to look a little bit farther out, maybe that extra 5, 10, 15-minute drive may be able to expand your search to facilities that would actually serve that loved one better. Mm-hmm. And so don't be caught in thinking, well, I have to stay close.
Is that for the people as much as the person that's in the nursing home? Is it good for the person that's in a nursing home to be further away?
Not necessarily, but just that you don't want to keep your focus of where you're looking so close that you leave out other facilities that may be actually better than those closest to you. Another trap is looking at the expense. Now, I know that nursing home expense and long-term care facilities are tremendous expense, mm-hmm. but sometimes just a little bit more spent per month can get you into a whole new arena as far as nursing home care. And not always as we show there, the fanciest home may not be always the best, because the care being given by the individuals in that facility is the most important issue, mm-hmm. not necessarily the surroundings that they're in.
I notice you have here the large chain homes versus the smaller. Is bigger better?
The large chain nursing homes do bring some things as far as being able to have sometimes expertise of consultants that can help that nursing home with certain issues. But on the other hand, a smaller privately owned home may have a more stable staff. They may have mm-hmm. People that are there more concerned. It depends on the staff.
You see a lot of nursing homes. How many, I don't think those who have joined us would know, but how many homes do you see a year? How many places do you frequent?
I have patients in roughly 20 to 25 different nursing homes, so I see the whole gamut of what's out there in the long-term care industry today. So
you're looking really, we're talking with someone here who really has seen a lot. So when we're talking to you, we're talking to someone that can give us a lot of good ideas. Let's say you found a home that you feel fairly comfortable with initially. How do you gauge next, concerning the staff, the stability, and all that? How do you get at that?
Well, again, in our next illustration, we look at this issue of staff stability, and that really is the key to the care that your loved one can receive. And a way that I've seen in trying to determine the stability or an appropriate gauge of the stability is looking at the director of nursing and the administrator. Those two positions are the most important. They provide the most stability long-term in that staff. And I've seen that if they've been there for 2 years or more at a facility, you can recognize that here's a stable environment for my loved one to be in, because they'll have the ability to know over the long term what's been going on in that facility and be able to help.
So they've been there a while. Anything else that you should look for?
Well, there are other ways to look at the staff, too, when you're looking to go to that facility for the first time to look at it. Sometimes going unannounced mm-hmm. may be important. going on the second shift. For most people, they go to visit their loved one on the second shift, the evening shift. And so going there before you
normally do, or when people would expect you to come, going someplace where they don't know you're coming.
Right, and seeing how they respond to you, how they help you can be helpful.
Is it important to go at meal times?
Seeing how they help the residents at mealtime, seeing how they interact with them, how friendly are they, how do they treat the residents. You know, the golden rule in Luke of doing unto others as you would want them to do unto you really plays a big role here in seeing how they interact with those residents.
Can you trust someone that's a resident there, talking to them? Do they know what's going on, or you know, how would you be able to tell? Is that a wise thing to do?
Well, in the nursing home population today, roughly half of them have Alzheimer's disease of varying forms. So
got to be careful.
You have to be careful, because sometimes you may be talking to someone that is unable to really give you that information.
Let me ask a question that you know, you and I were discussing before the program a bit. You know, this is sometimes a very hard decision for people in the family, sometimes a very hard decision for the person that may be in the nursing home. And when you're dealing with those situations, when you're dealing with those family dynamics, I know they're all different, but let's say there's someone watching today that just, you know, they've been struggling with this, and their mom or their dad says, look, I never ever want to go, I've never wanted to go to a nursing home, and they have these pictures in their minds of nursing homes being terrible places. Is that the reality? Are nursing homes really terrible places?
You know, Don, in the last 10 years, as I've practiced, I've seen a tremendous change, really, in nursing homes. And I think that's true across the country. Now, there are places where that may not be the case. But by and large, they have improved, and a lot of that is due to the survey process that takes place. But
so, in other words, the idea is, don't just assume that every nursing home is bad, or you know, that you shouldn't look at that. You know, let me ask this other thing. We live in the baby boom generation, so to speak, where they're getting older. They're starting to have to use these facilities, and I think that's one of the largest population bubbles in recent times. Is it really realistic to think that all of those folks will be able to stay at home? And I heard one time, and tell me if I'm wrong, a statistic that only 5% of people when they get older go to a nursing home. Is that right or wrong?
right, I mean, it's a small percentage, really, but that have to end up going to the nursing home. And there is a larger and larger push for home health care, those kind of things, trying to keep people at their home, and that has made a tremendous benefit to the elderly.
We've been talking with Dr. Kevin Bryant. He is a specialist in family practice, focusing on the older person, the geriatric patient, and also really dealing with nursing homes. We're talking about how we can choose a nursing home, and when we come back, we're going to look a little more closely, and I'm going to ask Dr. Bryant questions about how we can really look a little closer at a nursing home and make the right decision at what he has told us is one of the most important decisions we could make. We hope that you join us.
Have you found yourself wishing that you could shed a few pounds? Have you been on a diet for most of your life, but not found anything that will really keep the weight off? If you've answered yes to any of these questions, then we have a solution for you that works. Dr. Hans Diehl and Dr. Eileen Leddington have written a marvelous booklet called Reversing Obesity Naturally, and we'd like to send it to you free of charge. Here's a medically sound approach successfully used by thousands who were able to eat more and lose weight permanently without feeling guilty or hungry through lifestyle medicine. Dr. Deal and Dr. Ludington have been featured on 3ABN, and in this booklet, they present a sensible approach to eating, nutrition, and lifestyle changes that can help you prevent heart disease, diabetes, and even cancer. Call or write today for your free copy of Reversing Obesity Naturally, and you could be on your way to a healthier, happier you. It's absolutely free of charge, so call or write today.
Welcome back. We've been talking with Dr. Kevin Bryant from Wichita, Kansas. He is a specialist in family practice, more specifically in geriatrics, and we're talking about how to choose a nursing home. Dr. Bryant, how important is it to include the person who's going to be living in that nursing home in the process of selecting it? Let's assume that they don't have Alzheimer's, or they don't have organic brain syndrome, or they don't have some of these different things that we've mentioned in the first part of the program.
Well, given that, then having that person involved in that decision is paramount. I've seen many cases, unfortunately, where the person was left out of that decision, and it was devastating to them, and led to, I think, sometimes an early demise on that person as they give up hope, and they don't see this as an opportunity to possibly even grow in the setting.
What are some ways that we could get them involved in the process?
Obviously, having them look at the facility with you, going there, visiting, maybe talking to the staff, talking to other people.
You know, one thing, if I could just share a little bit of my own personal thing, experience. I know I have an aunt that her family lived not too close to her. She's a diabetic. She's had some problems. She's actually a great aunt. And she had a large house. She had a lot of things to take care of. These things were getting overwhelming for her. She couldn't mow the lawn, keep up with the garden, do all the laundry. Plus, it was a bi-level house, so she's going up and down the stairs. A lot of hazards there, and no one really to help her if she got into problems. But she really didn't want to go anywhere else. She's sound of mind and many different things. All these things are positive. And so her family did, like you said, they took her to different places. She really didn't respond until someone said to her, well, why don't you try living in this extended living center? It wasn't a nursing home section of it. Assisted living, and then there was a nursing home next to it. Try that for 6 months. Keep your house, keep all those different things, keep involved in that. And so they arranged that, and she did that. And, you know, just a couple months ago now, I was talking with her on the phone. She says, you know, this is a great place. I mean, they have a piano for me to play. They have this, they have that. And I think I don't want to worry about my house anymore. And so she made the decision.
Yeah, for some people, as they grow old, they become isolated, and this becomes an opportunity for them to get reconnected to their society in some of these facilities.
You know, before we leave that subject, you know, some nursing homes, I know for years, I visited nursing homes on weekends. We would go there, we'd sing songs to the people, and we'd have a little worship with them. And my parents liked to do that, and we did that together with other people in our faith community, in our church. And I noticed that some places had a lot of programs for people. They had a lot of things and whatnot. What kind of questions should you ask? I mean, maybe that's that unannounced visits and looking at things, but how can you tell that this is a good place?
Well, yeah, going to actually visit when they have an activity going on, and most facilities have a calendar where they actually list all the activities that are going to be taking place. So you can see, are these activities that that your spouse or your aging parent would enjoy? And talking to each facility is to have an activities director that is to even personalize for that person activities they enjoy doing.
Let's look a little closer. Okay, you've gone to the place. Maybe you feel comfortable with the nursing home. Maybe your family member feels comfortable. Maybe they're ready to make that decision, and you want to look through someone else's glasses. You want to look at what other people are saying about that. What's the next step?
Well, there is one other way to look at a facility's performance, and that is through what are called state surveys. And each state is required by the federal government to do a survey of the facilities. And they look specifically to see what deficiencies they have in federal regulations that are involved with the care of patients.
Mm-hmm.
Now, each facility is required by law to have available for anyone the results of their most recent survey.
Mm-hmm.
Those are sometimes difficult for lay people to look through and read, but probably the most important thing to remember out of state surveys is that they're categorized, the deficiencies are categorized into various levels,
Mm-hmm.
and if it is a level G or higher deficiency, this would be a red flag, because that means that actual harm has been done to a resident.
So G rating may be good for the movies, but it's not for the nursing homes.
For the nursing homes, G rating is not.
Will people be forthright with that kind of information if you ask them, hey, is your survey a G rating? Are nursing home administrators and staff, do they have to tell you what it is, or do they try and get around that sometimes?
Different homes may have different levels of transparency as to their state survey. That's true.
Do they have to let you see it?
It's there for anyone to look at, and they usually do try and let you know what's been going on.
Now, having worked in a hospital for a while myself, I know that we had Joint Commission that came to our hospital, and they would review it. And it was kind of dependent on the team that came. You know, if somebody was just having a bad day and they just didn't want to get through their day, they didn't look so closely at where I happened to work with an emergency department. But other times they were very, very meticulous. Can you really trust a state survey?
I believe by and large you can. It does depend, as any survey process is dependent on the human being doing the survey. Mm-hmm. But it has really dramatically improved, I think, the care overall in long-term care in the last 10 to 20 years that these surveys have been done.
Mm-hmm. So it's something you should look at. Is there anybody that can help you with that, looking at that survey? You've said it's kind of hard. I mean, simply you've said look at the G rating, but let's say you want to get a little more specific. Is there anybody that can help you look over your shoulder and help you with that?
There are what are people called ombudsmen
mm-hmm.
that are assigned to each nursing facility, and the phone number to reach them should be available in each nursing home. They can help you understand.
I don't know if I can say ombudsman too often, but if you say, hey, I want Bud's phone number, they may be able to help you, and right. They will be able to help you. Well, that's going to be very helpful. What else can we do to really assess the care that's being given in a nursing home?
Probably your own eyes, your own ears, your own nose in some cases in a facility is going to give you, and going with your instincts as you see, trying to talk to residents that are able to give you answers is helpful. But once a person has chosen the home that they're going to go into, now really the work begins in being able to ensure that the good care is given. In our next illustration, in the last remaining minutes, we want to look at what I think is the most important part, and that is how to ensure that the care you're looking for can be given. And it starts right with, even to the point of acquainting yourself with the staff members by name. Getting to know those staff mm-hmm. members by name lets them know you value them as a person and are wanting to know them personally. Mm-hmm. And that reflects then in that care. Being willing to help where you're able to help. Mm-hmm. hands-on care.
Don't just assume they're going to do everything, hand them the water, do this. Don't demand that they do this or that, but more of a family approach.
Right, a family, a team approach. You're part of the team. You're wanting to help where possible. Lets that staff know that you're pulling with them in the care of that person. And then I think one of the most important things is the issue of praising, trying to find everything and anything that you can to praise in the staff as they give that care. This is some of the hardest work, I think, done in America, is caring for our elderly, aging population.
We need to appreciate and affirm people that do that well.
That's right. And praise will go a long ways towards them being willing to go that extra mile with your loved one, and being able to show it even with gifts, not contrived or anything, but anything from baked goods, whatever, letting the staff know you appreciate the care that they've given to them. And then not wanting to nag the staff. I've seen this before where they almost get into a confrontation with the staff, and that leads to disaster. Doesn't help because the staff pulls away.
I notice here you say that it looks like you need to follow the chain of command here if you do have a problem.
Right. The chain of command, going to the person that you have a problem with initially. If that doesn't resolve it, then moving up to their supervisor, and then finally ending up with the director of nursing or the administrator can help resolve issues.
And it's showing respect to each level of that, probably, isn't it? Saying what's going on here, and then, you know, my mother works in a nursing home, and she says that all the time. People will come in, they'll bypass her, they'll go talk to someone else, and it just doesn't work well. And she says, you know, why didn't you talk to me? My mom's been a nurse in a nursing home for, I don't know, 20 years now. And, you know, she loves these people. She'll just be crying if someone dies, and she gives her life for that. And, you know, I think that's very good counsel. Tell us about the storybook. We've got about 30 seconds. What's that about?
Well, in helping the staff come to recognize this person as a very valued member of your family, sometimes developing storybooks, pictures that explain different phases of that person's life.
When they were a child, what they did is for work, all those different kind of things.
Can be very helpful for the staff to recognize who this person is, what they've contributed.
They're not just
to
in that
society.
little gown. They're not in this situation. They're a real person.
Right.
Thank you so much for being with us today, Dr. Bryant. I know this will be helpful information, and thank you for joining us. We hope that what you've learned today will help you help your relatives, help others have health that lasts for a lifetime and is meaningful right up to the last moment.